Hi, this is Paul Barr, Senior Writer for Hospitals and Health Networks magazine. I'm here with Richard Nagengast, Director of Patient Accounting for Northwestern Memorial Hospital in Chicago. Northwestern is part of an effort organized by the Metropolitan Chicago Healthcare Council to simplify patient billing and explanations of benefits. Thank you for being with us here today, Richard.
Thank you, Paul.
Can you explain exactly what Northwestern has done to change the way patients are billed?
We've been looking at how our patients are billed for some time now, trying to find ways to make that process an optimal patient experience. And it's no small challenge because who likes to get a bill? Well, one of the things we've been focused on, again, is to making sure that information is accurate and clear to understand, and that we give patients choices as to how to pay the bill. What we've noticed in doing some of our research and exploring how our patients behave is that many of our younger patients especially pay their bills online. We already have a web portal that patients can use to pay their bill, but the penetration was never what we expected. I expected it to be a higher number. So in looking at our options, we came across an opportunity to provide patients increased convenience and to offer them the option of paying their healthcare bills in a way that in a place where they pay their other bills. It's further enhanced by the possibility, which is what MCHC brings to the table, of really working with the insurance carriers to be able to marry that information with the explanation of benefits, which really details for patients what was done, what was covered, and if it wasn't covered, why. Often for patients right now, if you're a regular family guy, you may have your children, your spouse, and other members going to more than one facility, and you have to have references and piles of paper. What we liked about the approach that DocSo offers is a digital file cabinet where virtually any document that you would require to be able to decide whether the bill is correct and whether it's appropriate to pay at their fingertips. So again, our focus was how can we streamline the ways that patients can pay their bill. That's good for us because it increases convenience for the patient. By doing it earlier, we hope it distinguished the ways that we serve our patients. And also it helps us reduce our expenses and really reduce the administrative costs associated with healthcare delivery so that the focus can be on the expenditure towards patient care. Postage and paper is no small expense. And when you're looking at a scale of the number of patients that we treat here at Northwestern, that's no small number. So again, it was reasonable, it looked cost effective, and we decided to release it on a scale where we'd be able to monitor it. And while we've only been live for about 30 days, we've been very encouraged with not much promotion at the adoption rate that we've seen. We've been able to evaluate how patients are using the portal, any issues they may have along the way, and we're actively refining those processes right now. And we're hopefully in another 30 days or so be able to do a bigger promotion of the portal, making patients aware, again, of the various ways that they can pay their bill and have at their fingertips information to be comfortable that they're paying their bill.
How does this fit into, say, what's going on with healthcare reform?
Well, healthcare reform, I think, for patients is going to, in some cases, increase their out-of-pocket expenses, depending on the choices they make. I think healthcare reform will make more people have insurance who perhaps in the past weren't used to some of the nuances of what's covered and what's not covered. So again, I think it's a great opportunity to educate patients and to make it easy for them to try to understand. I think it also will prepare us better for increased patient out-of-pocket. So patients can, again, look at a convenient way. They could set up a payment plan. They could evaluate what they need to pay and when they need to pay it. So we do feel we're on the leading edge of trying to give our patients as many options as possible and to be able to accurately inform them of what their responsibility is. And it's one of several approaches we're taking. We're also trying to the best of our efforts and as information is available, making patients aware of what their out-of-pocket responsibilities would be closer to when the service is provided. So it's one of many options we're taking to really try to make our patient financial experience the best it can be.
How extensive is it right now in terms of what's included in the billing, and what are your plans for expanding it in the future?
Well, right now as a hospital, we are able to consolidate all the services that are provided at the hospital in a single patient statement. But as any patient or consumer knows, when you go into a facility, there's multiple providers, not all of them billing in a consolidated way. So as we work on our own experience and streamlining and making this process as seamless as it can be, as efficient as it can be, we'll be looking at expanding the same option to our other campus partners so that physician billing or any service billing can, again, be integrated if there's the interest. And I think patients will see that as a big plus because patients come and have their care delivered. They don't see it as being multiple providers providing their care. They see a coordinated effort, so we'd love to be able to give them a coordinated approach to pay their bill.
Thank you for being with us today.
Oh, it's my pleasure. Thank you.
This is Paul Barr with Hospitals and Health Networks magazine. Thank you for watching.